I am Dr. Pranshu Mehta. Welcome to the series Aesthetic Medicine and Injectables. Well, I have divided this series in such a way that we can divide lectures in a systematic progressive order. So we'll be starting with a few topics today. So I'll just explain you the layout, how I have planned this. So we'll actually first read what is beauty or what is aesthetics. First, we should know what do we actually mean by beauty or aesthetics. Like what was the history behind this? So, what is aesthetics? We should know what is aesthetics before we start. Then we'll read about what material we're going to use. So, if a patient or a client comes to us and we want to add some fillers, what fillers or what materials do we need to add? So, we should know about all the materials. We'll read about that. Then we'll move on to that how do we know that what we need to improve. So how do we know that a patient or his or her face requires improvement? So we need to analyze the face of the patient. So we'll read about the facial analysis. So once we're done with the facial analysis, we will know which part we need to improve. So when we are ready with the treatment, we'll need to prepare our patient. We'll have to prepare our patient based on what all procedures need to be done. So we'll explain the procedures and we'll prepare a patient. So we'll read about how to prepare the patient. Last but not the least, and very important, or you will say most important thing for most of you all, to learn about the procedure or the treatment. How do we do it? What do we do? So this is the order. We'll read about what, then what are the fillers, then what is the facial analysis, then the preparation and the treatment or the procedure. So this is a online series. It will consist of a few lectures, not just one. So after you are done with the series, you'll be able to, whenever you look at a face of a patient, you'll be able to analyze the face in a aesthetic way. You'll be able to analyze the face thinking or keeping the facial aesthetics in mind. Then you'll be able to tell what fillers are needed for that patient, which type of filler and where. Then you will be able to tell how to inject it, however only theoretically because no hands-on for now. Then you'll be able to handle whatever complication if it occurs. And last but not least, you'll be able to compare and present a case of a patient, that how it used to look before and how it will look after the procedure has been done, the pre and post comparison. So let's begin. The facial aesthetics. Okay, so facial aesthetics, anything that improves the aesthetic outcome is called facial aesthetics. Now, that can be done either in a surgical manner or using things that are not non-surgical. So we'll be reading about the things that are non-surgical, like the fillers, the Botox, threads, and even mesotherapy. So, okay, let's do a bit of history first. What is beauty, or from where did the concept of beauty came? So, actually, in our history, specifically not ours, but if some of you must be aware about the War of Trojan, there was a king named Paris. He kept a golden apple which had this thing inscribed on it, fairest of all. So he had a competition in which he wanted to give this apple to the most beautiful lady. Now, there was a queen whose name was Aphrodite. She promised the king Paris that if you give this apple to me, then I will help you get the actual most beautiful woman in the world. And the actual most beautiful woman of that time they considered was Helen. So she was married, but then what happened? Because of this bribe, the king Paris gave this apple to Aphrodite and went for the queen Helen. And this became the major cause of War of Trojan. Okay, that was just history. Now, uh, again continuing the concept of beauty, there is something known as the golden ratio. Now, we all know the golden ratio, so we think that it might be given by a plastic surgeon or a surgeon. No, but it was actually given by the person who was an accountant. So, Luca Bartolomeo Pacioli, the father of accounts, is the one who is responsible for that ratio. He is the one who gave us this thing, which he in his texts at that time called as the golden ratio, or when translated to English, it meant from the golden heaven. And he wrote it in uh, Italian, dal mandata seal, meaning the golden ratio or the golden ratio of the heaven, like the one which looked as pretty as the heaven does. So this was his concept. He gave this ratio. And then later on, based on the same golden proportion or the golden ratio and the things which this person had described, the very famous artist Leonardo da Vinci, he created the painting, the Mona Lisa, which everybody knows is considered one of the most beautiful pictures in the world. This was based on the golden ratio, which was described by the father of accounts. So, okay, let's finish with this and then move on. So, today, uh, let's start with fillers first. We'll see what are fillers. We'll talk about what materials have been used till date or what are the current materials that are being used as fillers these days for injection purposes, not only on the face but different body parts. Okay, then we'll read about what are the different types of fillers. Then a very brief thing about the history of fillers, like how it started, which was the first filler, and how it has evolved over the years. Now, while reading the types of fillers, we'll also discuss about the advantages and the disadvantages of various fillers, because see what happens is we have many fillers which are being used these days. Currently there are 3 4 fillers, the materials which are being used as fillers, but all are you can say indicated in different areas because of their different characteristics, because of their different advantages. Okay, so let's start without wasting any time. Fillers, I'll tell you first of all, we'll see what all fillers we are going to read today. So we'll be starting with permanent fillers. We'll talk about how fillers started, which were initially used. They're called the permanent fillers. Then how collagen came into the market. The collagen was used as a filler. Then recently the hyaluronic acid, the HLA, the very important and a game changer sort of a filler, hyaluronic acid. Then the macro fillers, which are also made up of hyaluronic acid only. Then calcium hydroxyapatite. Then botulinum toxin. Actually, botulin or botulinum toxin, as we call as the Botox, uh, is considered a filler, but I'll say I'll keep it separately and I'll teach you this thing separately. Then we'll read about PRP and PRF, and we'll also discuss the combinations of any of the 2 fillers I've mentioned above. So, okay, starting with the permanent fillers. It was actually Francis Rind in 1844. See, this is a very interesting fact. Francis Rind is the person who made the first hollow hypodermic needle. Now, the sound seems to be complicated, but the hollow hypodermic needle is the normal needle which you use in your daily lives for injection or injecting substances or medicines. Now, this was 3rd June 1844. Now, this was the needle which had a hollow cavity in the center so that you could actually inject something through it using a syringe. Just before that, in 1830, it was Barold Karl Ludwig von Reichenbach. This person accidentally discovered, actually, I'll not say accidentally, but this was the person who discovered a material or a liquid, you can say, from beechwood coal tar or beechwood tar. Now, this substance which he discovered or actually found from the beechwood tar, or he separated this substance, this was the paraffin. Now, why did he name this as paraffin? Because param meant barely and affinus meant affinity. So this substance was barely, this substance had barely any affinity, and it meant this substance was inert. It would not react with other substances. Here, this was the substance that later on became the first filler to be used in the history. So it was paraffin that was used as a prosthesis, and you'll be surprised to know that the first filler that was used was not used on the face. It was used by Robert Gersney, and it was used for making a testicular prosthesis. So yes, this person used paraffin to make a testicular prosthesis, and it was used in a patient who was suffering from tubercular epididymitis. So yes, this. So just imagine, the first filler was used for making a testicular prosthesis, and it was paraffin. But since then, the paraffin, because it was inert, it was not reacting to anything, and gave a very good filler effect. Like it could show that you had something where you did not have. and it became very popular because of this fact, and it was used on the face for wrinkles. It was used for augmentation of breasts until 1911, when many cases of complications were reported by many people. And the first case of complication actually came in 1901. So it took 10 years for others to identify the complications. In 1901, a lady died because of paraffin. Now, how did the lady die? There was paraffin embolism seen. In the lady, paraffin was actually injected for urinary incontinence around the urethra. So, this patient, we had used filler for urinary incontinence, but because of the paraffin embolism that occurred and the lady died, this was discontinued. And this gave the birth to the most popular permanent filler, liquid silicone. Now, do not confuse this with the silicone implants which we use these days for body augmentation. They are encapsulated within a pack. This was liquid silicone which was being injected directly. So now this was very popular in the US, in the USA, specifically in Las Vegas and Nevada. But you'll be surprised to know that the origin of this liquid silicone, or like the area where it was first used, was Japan. In Japan, it was used for breast augmentation, that too by the Asians, and then later the USA found out about this, and it became even more popular in the US, in these two states specifically, about which I have already told you. So this was going good until the people and the girls specifically working at Las Vegas started noticing formation of fistulae. Now these fistulae started becoming serious, and this was seen as a life-threatening complication because many people lost their lives. The fistulae which formed due to the liquid silicone, the tract where they were injected, they became infected. The whole of the area became infected, and FDA officially told not to continue this. So liquid silicone was discontinued because of the serious life-threatening complications, and FDA had strictly told not to use this in US. Specifically, Nevada and Las Vegas had discontinued this and made this illegal. However, even till date, there are very few countries and very few places, like some in Europe, in Mexico, even in Asia, where they use this liquid silicone even today. So I'll say it's illegal and not safe. So better to stay away from silicone. Then came collagen. Okay, so we all know that collagen is a naturally occurring protein we have seen in humans, not only in humans but other living organisms as well. So in collagen, there are three types of fillers. One is heterologous collagen, then you have human collagen. In human collagen, you can divide it into two. So I'm writing it actually separately, but this both of these are human collagen only. Autogenic human collagen or isogenic human collagen. So this could be autogenic or isogenic. Now, as the name suggests, autogenic means the collagen which has been extracted from the same person, and isogenic means which has been extracted from some other human. So both are human collagen only. Like we'll read about autogenic and isogenic just below the category of human collagen only. So starting with the heterologous collagen, it came in the early 2000s. So it was like launched as a product mainly for the facial aesthetics. Now this was the first filler to be used as the facial aesthetics filler. Specifically, it was bovine derived. Then it gained popularity because it was used for the facial wrinkles, necklines, the décolleté area. Now there was one very important drawback for this. There were patients, like there were reported cases of people having allergic reaction to the heterologous collagen. Now the issue was, many people suggested allergic test, or you can say the prick tests, but there were many cases who were negative to the allergic test, however showed proper positive allergic reactions once the procedure was done. So there was a person called Pons Gerard. He suggested a double allergic test which lasted for 7 weeks. So a first dose of 0.1 ml was given, and after 72 hours, the first reading was noted. A second dose was given, and again after 72 hours, another reading was taken, and then the second dose actually was given after 15 days of the first dose, Then a third reading was taken after the 4 weeks. So a patient who came positive with any of these readings was considered to be reactive or allergic to this heterologous collagen. And for being positive, there could be erythema, induration. Some people had nodule formation. Some even had abscess. In fact, necrosis was seen in some, but that was because when collagen was directly injected into the vessel, there was a long waiting period, and because of the long waiting period and the necrosis and the complications that were seen, Johnson and Johnson decided to discontinue it in 2009. Then came the human collagen, but there were drawbacks initially only. Like as it became popular, it had major drawbacks initially only, which were it was too expensive, like everybody could not afford it. Second, it was very difficult to prepare. Now, this human collagen we divide into two: autologous, isologous. Then, talking about the autologous collagen was taken from the same person, the skin of the same person in whom we had to inject the filler. So for this, approximately 10 to 13 centimeter square area was excised of the skin for forming 1 ml of the collagen. Now imagine making 1 ml of collagen, that too with the concentration of 5%. We needed 10 to 13 centimeter square area. Now this collagen was injected in 3 or 4 injections, a few weeks apart. As we know, this was autogenic, so adverse reactions were pretty limited. However, very few people showed flare and erythema at the site of injection, which was thought to be due to hypersensitivity. However, not any major contraindication or not any major complication. Still, because of the cost and the preparation, that 10 to 12 centimeter square, the skin which was required for making 1 ml, and do not forget 30% overcorrection was required with this filler, because it would ultimately the result would come down. Now coming to the fourth, the isogenic human collagen. Now the isogenic human collagen was actually, you can say, taken or derived from the cadavers. However, no virological disease like the hepatitis B, hepatitis C, or HIV was transmitted or reported ever. Now, again, there were two teams which believed that allergic tests should be done, and one believed that there was no need for doing any allergic tests. However, few reported cases were seen where foreign body granuloma like reactions were noted, so allergic tests were any day better. This was actually acellular collagen which was taken from the cadavers, hence chances of allergy were less, but still they were done. Okay, so this was used for wrinkles, for necklines, for decolleté area, and this gained popularity. But this was not that popular. Like people never used to go for facial aesthetics. Then came the game changer, the hyaluronic acid. Hyaluronic acid actually became the game changer. Like this made facial aesthetics very popular. It was described in 1934 by Palmer and Mayer as hyaluronic acid. So hyalos meaning glass, and uronic because of the sugar, the uronic acid sugar which is found in the material. This was found and derived initially from the cow's eye. This was found to be there in cow's eye. Now, very beautiful thing about this hyaluronic acid is this is very diverse and present in all the cells of our body, and is responsible, like plays major role in many things, including cell division. The FDA in 2003 approved the first hyaluronic acid filler for facial aesthetics. So let's see what hyaluronic acid is. Hyaluronic acid is nothing but a natural complex sugar. As I've already told you in the name, it contains uronic acid in its sugar, and it is found in all living animals. Like it is one of the very few elements present in all living organisms, like all living organisms, that is identical from unicellular organisms to the human beings. So it is present in everybody. Second thing, it is hygroscopic in nature, so it can bind to water, and that to great quantities of water. Plus, hyaluronic acid has the capacity to bind to collagen and elastin. So imagine something which binds to water and binds to collagen and elastin as well. Now, when it binds to water, it gives volume and hydration to your face. So it makes youthful looking skin and it makes the face fuller. But because it is binding to the collagen and elastin as well, what it will do? It will reduce the signs of aging because it will bring elasticity. It will help, see, it will not help produce any new collagen, but it will produce elasticity because it is binding to those collagens and elastins as well. But now we know that it is present in our bodies, so it means it will be very easily metabolized. And the things which are responsible for its early metabolization are increased oxidants, UV rays exposure, pollutants. Now, this is what leads to reduction in volume of HLA or hyaluronic acid in our skin and is responsible for aging. So, if I inject somebody with HLA, it will be metabolized very easily and it will require repeated injections. This will reduce the compliance of the patient. So, patient will say that I don't want any more treatment with the HLA. And for the same reason, they introduced cross-linked hyaluronic acid. Now, what do you mean by cross-linking? So first we should know what is HLA. HLA in normal form is present as a liquid. They are actually individual chains of polymers, not too long though. So what they did was they cross-linked these individual chains to each other and converted this liquid into a gel-like structure. Now this gel was sort of semi-solid and its hardness depends basically on the degree of linking. So if cross-linking is more, the density of this gel is more. If the cross-linking is less, the uh, density of the gel is less. How does this affect the metabolization? So the cross-linking reduces the metabolization. Hence, the dermal fillers these days are made up of cross-linked hyaluronic acid. And this cross-linking is done with the help of 1,4-BDDE, that is 1,4-butanediol diglycidyl ether. This is used for cross-linking the hyaluronic acid. This increases the time interval between two hyaluronic acid injections. So for example, if I inject some patient today, the hyaluronic acid can stay there for approximately an year or maybe 1.5 years or 2 years depending on the density or the uh, density, or you can say the strength or the hardness. Okay, now from where do we get this? We get this from bacterial fermentation of the Streptococcus equi strain. Okay, so the Streptococcus equi strain is the one which we use for fermenting and making the hyaluronic acid which we use commercially these days. Now, moving on to hyaluronic acid and its properties again. The hyaluronic acid, as I've already told you, is cross-linked, which we use. So, in the fillers, it could be in reticulated or non-reticulated form. Then there'll be some degree of cross-linking in this. Plus, there'll be some amount of free hyaluronic acid present in all the fillers. Then there'll be a modulus G, the G value written of the hyaluronic acid filler. Now this reticulated, non-reticulated as well as the degree of cross-linking decides the size and the particle, like size of the particle. Plus this liquid or the free amount of hyaluronic acid acts as a lubricant for injecting. This modulus G is nothing but tells about how resistant is this filler. Like more the resistant filler, like the more the resistance, you'll know that this filler cannot be deformed. Okay, so quickly recapping what we have done today, we have done permanent fillers, we have done collagen, we have done hyaluronic acid. Now the macro fillers are nothing but bigger chains of hyaluronic acid used for breast augmentation, butt and thigh. There was a product called Macrolin, but this has been discontinued, so we will not talk about this. Then moving to calcium hydroxyapatite, our next filler, calcium hydroxyapatite. Now, I think most of you would be very familiar with this. This has been like you must have heard about this in dental procedures, some implants, even in ortho, even in E.N.T. Some case reports have been there where people have used it for filling up the cavities. However, for facial aesthetics, it was in 2000 when the US approved Radiance, these days called as the Radiase, which has 30% calcium hydroxyapatite, 70% aqueous solution. The size of the particle is 25 to 45 microns, and the mineral density of this is exactly similar to the mineral density or the mineral portion of our teeth and bones. So it is just equivalent to the natural mineral uh, proportion. Okay, so this is synthetic, and these fillers are steam sterilized, so they are free of any infection. They are latex free, so no chances of allergy. They're semi solid. They have amazing cohesive power, plus very important, they are biodegradable. So because of these, they can be used as a subdermal filler or even deep fillers. I'll tell you how. So injection technique for injecting these fillers, normally as we inject the fillers, we can use it in the subcutaneous plane or the subdermal plane. This can be used in both the planes, either subcutaneous or subdermal. However, this can also be used in a plane just next or adjacent to the periosteum. However, we are not injecting this into the periosteum, but just next to the periosteum, for filling up or enhancing any bony defect which has been caused due to age. Because of aging, you will see that bone starts to lose its density. So even there, you can use it to enhance the bony defect, specifically wrinkles, the nasolabial folds. Okay, we'll talk about the specific treatments of specific uh, places later. But for now, whenever we are injecting calcium hydroxyapatite, we'll use a very small needle because this is of low viscosity. We can even add an LA because because it becomes painless. So the calcium hydroxyapatite is eaten up by the macrophages and is excreted from our kidneys in the same way the calcium and the mineral content of our bones and teeth is maintained. So there's no issue with that. Like, it is normally excreted via the kidneys. Okay, moving to the next one, the botulinum toxin or the Botox. See, I've already told you, I'll prefer calling it as a toxin instead of calling it as a filler. Actually, yes, it helps in removing the wrinkles, but how? By relaxing the muscle, not by filling up a space. So it's not being used as a filler between two things. However, we have classified it over here as a filler. So it's not giving volume and removing wrinkles, rather, it is relaxing the muscle and then acting as a facial aesthetic agent. Okay, moving to the next one, PRP, platelet rich plasma. I think almost everybody in this attending this would be familiar with this. It is rich in growth factors, almost about 10 times as compared to the normal blood. So obviously, when there are growth factors, they'll help in collagen formation, and hence PRP can be used as a filler alone or with other, like in combination with other fillers. So it can be used as a partner with HLA, hyaluronic acid, calcium hydroxyapatite, even with other fillers X. Now, how and where, we'll talk about it. Okay, so first of all, let's discuss where we need to add this. So for that, we'll compare HLA and calcium hydroxyapatite. So hyaluronic acid adds volume because it's hygroscopic, plus it adds elasticity because it binds to collagen. So how much time does it last? It can last minimum of a 6 months to maximum of 2 years, average 12 to 18 months. Okay, so but once this fades off, we need to repeat the injections and the person comes to normal. Like, it has not on its own helped in forming any new collagen, whereas calcium hydroxyapatite adds volume but not as much as hyaluronic acid. Because see, it will add volume as much as hyaluronic acid, but it does not have hygroscopic nature. It will not add the hydration effect. It will add the volume, not the hydration effect. Plus, this volume will be phagocytosed by the macrophages, and it will lead to, uh, you can say, healing, which will add new collagen. So after 2 years, when the calcium hydroxyapatite is totally eaten off, the person will be still better than the normal. The person would have improved even by 2% because new collagen formation would have occurred, which does not occur in hyaluronic acid but would occur in calcium hydroxyapatite. So in the places where I need some collagen formation, deeper wrinkles, I'll prefer or I'll go for calcium hydroxyapatite. Now, if I add PRP to hyaluronic acid, this improves formation of collagen. Now, if I add PRP to calcium hydroxyapatite, it further improves the collagen formation. Plus, it will also add one more thing. Now, what is that thing which is added? Initial volume effect. The initial hygroscopic nature, the initial volume effect will be added in this PRP with Calcium hydroxyapatite. Okay. So for deeper wrinkles, I'll go for calcium hydroxyapatite because a very less amount of volume will be required, whereas a large amount of volume will be required of hyaluronic acid. But in a case where I want younger looking skin, natural looking skin, or rejuvenation, like hydrated tight skin without filling of the deeper wrinkles, I'll go for hyaluronic acid. So the third X which I had written, that's a secret filler which I'll tell you in the next class, which I had not classified today. So for today, I'll just wind it up. Let's discuss whatever we have learned today. So we have seen what is beauty, the golden proportion of the golden ratio. However, I have not told you the exact golden ratio, which we'll discuss when we discuss the facial analysis. We have discussed what are fillers, what are the type of fillers. In brief, we have also read about the history of fillers, like how fillers were started and what all fillers are there today. Now, what should we expect from the next class? First of all, we'll discuss about the secret filler, the new edition. This filler is not that popular till now, but will have amazing potential in the future. Then we'll discuss how to know where we need to add a filler, when we need to add a filler, and which filler is needed, because there are many fillers which are used. As I told you, hyaluronic acid, then calcium hydroxyapatite, and the new filler which I'll tell you. So for that, we'll learn about facial analysis. Facial analysis is the one which will tell you where we need to add a filler, which filler we need to add, and for what reason. Like, this will give us all the answers. This will read in the next class about the facial analysis. So whenever you'll see a patient's face, you will automatically start analyzing the face. You will know what are you looking at, what if improved will improve the profile of the patient. Well, that's all for today. I am Dr. Pranshu Mehta, and this was the first lecture of aesthetic medicine and injectables. For the same videos, they'll be uploaded on the YouTube channel, the E.N.T Surgeons. Not only these, there are other videos which can be useful for all the E.N.T PGs as well as the undergraduates or anyone looking for learning new concepts in E.N.T. You can follow the E.N.T Surgeons on Twitter, Instagram, Facebook, and YouTube. See you next week.